The current practice for the moderate and severe immunotherapy colitis, their treatment options are very limited. Frequently, as a frontline, we use immunosuppression like corticosteroid with biologic agents such as infliximab and vedolizumab in treating these conditions. However, their immunosuppression, they have a risk of complications such as infections or even counteracting effect to immunotherapy that may lead to negative impact on cancer outcome. So we are in the great and urgent demands to develop a brand new, novel, natural, safer, as efficacious treatment for immunotherapy colitis, and that's when the fecal transplant come into play. There are already animal studies and translational human subject studies that have shown microbiome play a key role in pathogenesis of immunotherapy colitis several years ago. Therefore, my group performed the first fecal transplant in the universe for immunotherapy-induced colitis in 2017 with high success. And we published our first 2 cases in Nature Medicine in 2018, and an extension of 12 patients that received this fecal transplant in Science Translational Medicine in 2022. In those preliminary analysis, we have shown that there is signature microbiome changes before and after fecal transplant, especially when comparing the responders versus non-responders. And also we did the immunohistochemistry analysis, and we see some immune cell infiltration changes also between the responders and non-responders. I think that's the main kind of reason behind that explains why microbiome alterations can reverse this inflammatory process. So in the future, potentially, microbiome alteration by fecal transplant can be a future standard of care treatment for this challenging medical condition.